Hello and welcome to the Spine and Nerve Podcast. My name is Dr. Joves.
And my name is Dr. Nicolas Karvelas.
And we're going to take a break from extreme amounts of science, which is going to make Dr. Karvelas a little sad, but it is football season. So in case you're listening to this in the future, we are now just after week 2 of the 2020 COVID-shortened or differentiated NFL football season. We are Northern California sports fans, and the San Francisco 49ers have just been absolutely decimated by injuries, with roughly half of their starting positions now injured. And I think a lot of the questions that have popped up in our heads, but also I think nationally, is there something that's going on with this NFL season that is differentiated because there was no preseason, because a lot of teams did not do as much contact drills beforehand. Is there something different about this year as far as injuries are concerned? And so Dr. Karvelas and I just wanted to kind of talk a little bit about that, kind of go a little bit into some of the literature, although there's not a lot, but there is at least some data. NFL obviously tracks their injury data very well. And so I think we just kind of wanted to kind of dive in, and some of this might be a little emotional because we're looking at a team that is now playing players that were not expected to be starting on an NFL roster. So bear with us as that.
Yeah, and I think as you were mentioning a few things there, I know that especially on the radio, on TV, when people bring up the fact that there was no preseason in the setting of COVID-19, one of the first statements that are made is, well, guys like Nick Bosa most likely wouldn't have played in those preseason games regardless, which is probably true. However, we're not just referring, whether or not they would have got a couple of snaps is obviously debatable, but I think even more importantly than that, even though these guys, again, using Nick Bosa as an example, the guy's obviously, out of this world, fit, guy, ridiculous specimen, and I'm sure he's training like crazy all the time, but there's nothing that replaces, being on the field with your teammates and obviously with other teams. But if we're talking strictly about the preparation for the season, being out there with your teammates, being on the field, having some level of contact, even if it's not full contact, all of that matters. And I think that's kind of the key points that we wanted to discuss today. Is not only in the sports setting does the kind of suboptimal biomechanics or conditioning, and when we're saying conditioning, not just strengthening, but that neuromuscular control, does that increase risk of injury? And then, applying that, another key point, applying that to what we as providers see on a day-to-day basis in terms of individuals dealing with more chronic pain pathologies, because as we've brought up before, but as is always important to emphasize, to not only increase the chance of success and the patient continuing to move forward with their very important foundation of treatment being physical therapy and home exercise program. One of the keys to that is doing it in a strategic and graded fashion. So we'll kind of come back to that point, but going back to the frustration that Dr. Joves brought up in terms of our beloved team here dealing with so many devastating injuries. In terms of sports, a couple thoughts that we just had, in looking at the literature. I thought one article was well done and interesting. This article was from 2012 in the Journal of Applied Biomechanics. It was titled "The Effects of Postseason Break on Knee Biomechanics and Lower Extremity EMG and a Stop Jump Task Implications for ACL Injury." And obviously, one of the things that we've seen early on in this NFL season has been so many ACL injuries. But one of the takeaway points from this article was that even with a relatively short time away from that, really replication of the activities that they're doing for their specific sport-specific activities, even with a short break, they saw significant changes in terms of the biomechanics, the forces across the joint that they were measuring, the changes in the EMG studies that they were doing, and then that putting the individual at higher risk for ACL injury. I thought just some real quick statistics, which obviously seem kind of common sense, but important to emphasize, that a study in 2007 found that across 15 NCAA sports, there were significantly higher overall injury rates in the preseason compared to the regular season, and that the overall injury rate during the preseason practice as well, not just games, but practice as well, was actually twice as high as during regular season practice. And that was a different study also published in 2007. So just kind of emphasizing and driving home that key point that, and like we've discussed so far, and Dr. Joves, your thoughts as well on this, but I don't think that it's just a lack of strength or a significant decrease in the strength of that muscle. I think it goes back to the neuromuscular control and the positioning of the joint and the stresses across the joint.
Yeah, and I mean, and if you go back and look, and I do want to give the NFL credit, they do a very good job of tracking injuries, of trying to monitor ways to help players stay on the field, prevent injuries. But if you look at the NFL data, it kind of coincides exactly with what you had just talked about. There are a significantly higher number of, especially ACL tears, in the preseason as opposed to in the regular season, right? And so that's that coming back from the off season, that's getting just back into very sport specific movement patterns. And I think overall the incidence of ACL tears has actually been slightly on the decline over the past decade. But if you look at the actual reports that the NFL has, every year it's about the same number of ACL injuries in the preseason as in the regular season. And obviously, it's that the preseason is 4 weeks and the regular season is 17 weeks, right? And so to have the same exact number, that means that the incidence is higher in preseason than it is during the regular season, by a factor of 4. And so it kind of coincides exactly with what you were talking about. And I think one of the arguments that can be made about this year is that there were injuries in week 1, but there was a lot more, especially bigger name injuries that happened in week 2. And whether or not, would you have expected that more injuries would have happened in week 1 if it was purely the lack of a preseason, the lack of, a normal training camp, might be one of the questions that gets posed. Or could it have been that people were, maybe a little bit more cautious in week 1 and people didn't play as many snaps, or whatever it may be, right? I mean, obviously, the first few weeks of the season are going to be different this year than prior, just because, they haven't had as much live action. And so ACLs obviously get a large amount of attention because it is a pretty devastating injury. It can take, a year plus for players to come back if they return back to their normal activity level. And granted, in this day and age, ACLs are something that are very successful, surgically repaired, and do a very good job. So a lot of these players hopefully will return back to the field. But you have some very significant players that have suffered these injuries, and I think there's going to be news stories about it. And God forbid something else were to happen this weekend, there's going to be a lot of discussion about this off season and how these players are returning. Which also, might be something that we have to think about, because currently NC2A is not in full swing. Mm-hmm. And obviously there's a very different set of expectations or pressure placed on college players, right? So this has to be part of the discussion that's going on. I mean, obviously, we're going to stay away from the COVID conversation today in terms of that. But I mean, we have college players that obviously are going to try their best to get on the field. Many of their goal is to get into the NFL, and how much this, a shortened season, shortened training camps, etc., might put on those players, I think, is also an interesting question.
Yeah, that's a great point. And before we wrap back around to applying this to our patients that we see on a day-to-day basis in clinic, I hate to bring up another incredibly painful memory for Bay Area fans, but just as another example of this, and I think we did talk about this at the time it occurred too, but obviously the other huge example of kind of going from relatively, I shouldn't say light activity. Again, these guys train so hard, but not game speed, not as sport specific. Not being out there on the field, on the court, going from more of a simulated environment to then being out there with these other ridiculously world-class athletes performing at the highest level. The other painful example of that is Kevin Durant for the Warriors, and he was looking so good just hitting threes, and like Dr. Joves and I were talking about before, this is just reminiscing, like, man, just keep shooting. That's all you had to do, was just keep knocking down shots. But obviously that was hearts and prayers go out to him for hopefully making a full recovery, which hopefully is on the near horizon here. But that was another example, and that just to kind of reiterate, for same thing for Achilles tendon rupture. Looking at the literature, we know that that most commonly occurs in adults from the 3rd to the 5th decade of life, and obviously that 5th decade of life, those aren't going to be elite athletes playing professional sports. Those are the quote-unquote weekend warriors who are relatively sedentary during the week with their work, potentially sitting at a desk, and then they go out and try to run or play a sport at a high level because they used to, which I'm very familiar with. But so yeah, just another example of if you don't have that kind of optimal gradation and work up to performing at that high level, it definitely puts you at risk of injury, at least based upon the literature we have available to this point in time.
Yeah, and so I mean, obviously, front of mind for us as sports fans, and as physicians that care for a lot of patients that have that deal with similar things. Obviously, the NFL and this season is going to. We're going to learn a lot. I mean, obviously, we're hopeful that more players don't have these devastating injuries. But I think we are going to learn a lot about what's necessary to prepare for an NFL season or for a professional sports season. But like Dr. Karvelas said, I mean, I think there's always something to learn in terms of being able to apply for our patients or for the normal public. And I think. Obviously, it's not going to be quite the same as saying, okay, well, a guy like Saquon Barkley, who's one of the most elite athletes in the entire world, having to figure out how to go from being just a training specimen to performing on the field and suffering an ACL injury. But for one of us, I mean, if we're going to go out and play some sports on the weekend or do some activities with our kids or try to be physically active. How do we make sure that we're taking those right steps to be able to prevent some of these catastrophic injuries? Because if you talk to most sports medicine surgeons, the patients, a lot of people get ACLs, and not all of them are professional athletes, right? And so trying to help to make sure that we're doing the things necessary in our gradation of activity to prevent injury as best as possible.
Yeah, and I think a good key point, when we are dealing with these patients, of course, the patient population Dr. Joves just alluded to, that being potentially younger or more active individual, not only treating their painful conditions as they come in, but even educating them early on. If they come in with a relatively mild a sprain or strain, I think that's a really good time to intervene and to make sure that they fully understand, the literature out there and what we know about this whole process. That's a great time, kind of preventative medicine. That's a good time to initiate that in that setting. The other take-home points in patient populations to think about are chronic pain patients, patients with chronic pelvic pain, patients with fibromyalgia, or chronic low back pain. All of these patients, I think it's important to, and we've talked about this before, not making assumptions that they've had an adequate trial of physical therapy, because in their head you ask them, hey, have you had physical therapy? Yes, it didn't help. But then taking the next step and saying, okay, well, what did you actually do? Because a lot of times it's, well, I went for one session, I didn't like the therapist, and it hurt afterwards, so I'm done. Well, that's, that's why, that's not an adequate trial of physical therapy, and that still needs to be, that physical therapy and home exercise program still needs to be revisited and optimized, because all the medications, procedures, and other interventions we do are not going to have the effect without that. And if you look at the different patient populations, chronic pelvic pain, obviously that's one of the most difficult patient populations to treat, but that's a good example. There is good data out there, good studies out there showing that pelvic floor physical therapy is effective for it. But what's also proven is if you just tell individuals like, hey, do Kegel exercises or do these pelvic floor strengthening, then they don't do well. And so it's really making sure they have the support, the education, and the guidance for these chronic pain processes, not only to prevent injury like we've talked about with all these other situations, but also to optimize their chance of success moving forward.
Yeah. So take home point: stick to the plan, right? I mean, physical therapy, whether you're a weekend warrior or a patient living with chronic pain, there is a process and a plan to that. Grading your movements and increasing them over time, is very similar to for that patient as preseason and contact drills are for the NFL player, right? This is the plan and the gradation of increasing slowly and making sure that workload is building over time is the same theory. And so so I know that, sorry, Nick Bosa, if you are offended that we compare you to a patient living with chronic pain, but it is the same theory that we're building on, right? We want to build that up, build up the tolerance, that activity tolerance, and specific activity tolerance to decrease risk of re-injury, of injury, of taking steps backwards in our overall plans to improve. Dr. K, anything else as we kind of close out and try not to piss off everybody in the NFL?
Nope, that's it. Thank you, guys.
All right, stay tuned for those legal disclaimers.